Good morning or good afternoon. My name is Jeff Cohen. I'm a research analyst at Ladenburg Thalmann. We are primarily focused on medical technologies and innovation. I want to thank Leonard for inviting me to the conference. I want to thank my associate Destiny Hans for assembling a lot of the materials here that you'll be viewing. These are our disclosures, which you may want to look at. As we all recall, I'm at an investment firm that covers, quote unquote, publicly traded companies. I'm going to continue here. Sorry if the slides are a little bit slow. So our focus is in a number of areas within medical technologies: cardiology, vascular, energy deliveries, bioelectrics, orthopedic spine, regenerative medicine, some specialty pharma companies, and some visualization and diagnostics. We currently cover 29 companies. The average market cap is about just north of $2 billion. And the median market cap, I think that's crept up the past couple of weeks from 300 million, probably toward 400 million. So this is a coverage list as we define it here. Certainly, if anyone's interested in viewing a research distribution on our list, just shoot me an email at jcohen@ladenburg.com. So you can see about half medtech, and then we define companies as biotech and diagnostics. It's also a number of companies there that we cover, and also some tools, services, as well as some specialty pharmaceutical companies. So as far as the U.S. market, as we all know, GDP in the U.S. is about 21 trillion. This year, I think it grew about 2.5%. Healthcare expenditure hovers around 18%, grew 4.6% in 19. I don't think the 2020 numbers are officially out, but I imagine it's somewhere north of the 2.3 for GDP and upwards of 4 or 5%. In Europe, as we all know, that's expenditure is far less. So you can see here, Switzerland, Germany, and France seem to drive those expenditures, but still as a percentage of GDP, it's low double digits, 10, 11, 12% on average. So this has been the COVID year. So COVID has been at the forefront and remains at the forefront. And there's been some lessons learned, some trials, some tribulations as far as fundamental companies and maybe not so fundamental companies. So we've seen disruptions in some areas of medtech, and certainly innovation and growth in other areas of medtech. There have been the agencies here, or the agency being the FDA, has been very active on a lot of companies, private and public, trying to make certain claims and promote products in the marketplace which are unproven. There's been over 1,240 fraudulent and unproven medical products and 105 warning letters. So this has ranged from commentary on companies' websites to what their product can do or may do, all the way to the hospital markets as well. So, across the board from DTC and OTC to the hospital market. So I'm going to move on to a few trends here that we've seen. So firstly, on the left is WatchPat, which is Itmar's home healthcare sleep solution, which has picked up share on two fronts. Well, because of its innovation, as well as the fact that sleep centers and polysomnography run centers have largely shut down in the U.S. I think, generally speaking, the sleep study market in the U.S. has been on the downtrend through COVID. Certainly, a number of sleep centers that have been open through last summer were probably on the order of a quarter to a half, and that trend's picked up a little bit. However, physicians, sleep specialists, and patients are realizing that these tests can be done at home, that you don't necessarily need to go to a sleep center, as WatchPad has demonstrated with Idmar's solution. CareCloud is a company that we that we cover that's involved in the healthcare IT space. Company's been around for about a decade. They've had a number of acquisitions, I think 17 plus acquisitions, now has over 40,000 physician members. And obviously, as we also all know, a tremendous amount of healthcare IT has been used in lieu of or to supplement physician visits. Aquadex is a aquafiltration system to decrease fluid overload in patients, critical care, as well as heart failure. The system's seen more and more usage in outpatient centers as well as the critical care centers and hospitals for COVID patients. On the right, you'll see the solution for Brainsway Medical. This falls under transcranial magnetic stimulation. There's about 7 approved products in the marketplace, of which Brainsway is one. And mental health is on the rise. We've all seen statistics out there as far as the increase in depression and mental health across the board. In the case of Neuronetics and some of the other players in their space, the requirement is that patients first fail medication or drug therapy. So we expect and anticipate a lag as far as further uptake in demand for these products, which we expect comes this year in the front half and the back half of the year. We've also seen some trends worthy of talking about as far as spine and cardiac, and I lumped the two in together with what I refer to as high-value procedures. And throughout 2020, what we saw was the following in the U.S. We saw in March the hospitals being overrun by COVID patients, and these type of elective or non-elective procedures, which fall under high value, plummeting. So we saw, procedure volumes in April and May and June, in some cases down 50 to 80%, depending on the specific companies. We saw those procedure volumes tick up through Q3, and we saw the procedure volumes further take hold on the upside during Q4. I think I can explain this in the following way. So obviously COVID took precedence early on last spring, and floors and areas of the hospital were being used for critically ill and COVID patients. And these high value procedures were put on the back burner, developing a backlog. The term elective was initially used as 0 to 90 days. If the person did not need a procedure in 90 days, they were viewed as elective. So the definition of elective changed over time. However, the hospitals, from a financial and economic standpoint, began to realize that they did not want to be without these high-value procedures. And they came back in the back half of the year, and they remain there now. We've talked to a number of hospitals that still have some backlogs, particularly in the cardiac area. So what we expect for 2021 is still unknown. We've seen guidance from a number of companies that do expect some further growth. Hopefully, the cases for COVID, particularly in the critical care setting and in hospitals, will continue to diminish. As far as this year, some interesting innovations worth mentioning are the following. And I'll kind of run through some of these. Carmat is a Paris-based company with a total artificial heart. We'll see more implants there in both Germany commercially and France, as well as an initial study going on in the US with approximately 10 implants for this year. The PONS is a Helios medical solution for MS, delivering stim twice a day. And it is approved in Canada, and we would expect an approval in the US. That's a venous valve on the top center, which is something very interesting. And that's a company called Hancock Jaffe, which will be doing a trial in the US with approximately 75 implants. Sanuwave on the bottom, which is dealing with wounds and diabetic foot ulcers, There's a tissue up top, a single piece tissue for a mitral valve. There's another cardiac product which pinches off a portion of the cardiac chamber, which has been deemed as dead. What we're also seeing is a tremendous amount of uptake in the genomic space. We cover a few companies there that have done tremendously well as far as their placements, their revenues, and their interests and their partnerships. So one worthy of mention is BioNano, which specifically focuses on unreadable or unobtainable data from traditional genomic sequencing. So they're focused on variants, and they've demonstrated a lot of data over the past year or two with picking up variances which are not recognized elsewhere with other equipment. Mention some other innovation that we're looking at and are aware of, which is involved in women's health, robotics, diagnostics, and imaging. There's a number of very interesting products here. We're also seeing a lot of uptake in the aesthetic market. The aesthetic market has been was also down a tremendous amount in the second quarter of last year and picked back up in the third quarter. And as far as the latest, aesthetics are up year over year. So they've truly experienced a true V-shaped bounce, if you will, from pre-COVID, from early February and March 2020. Some other noteworthy items here is a alpha pump for patients to rid themselves of fluid overload, an imaging solution from a company called Nanox, a robotic solution for the dental market, and some other imaging solutions for wounds and diabetic foot ulcers. What we've also seen is some uptake in women's health as well. So valuation-wise, contrary to how a lot of people think, in our mind, revenue is king. Revenue growth leads the pack. Generally speaking, we look at companies in early stage growth areas as a multiple of EV over revenue. Typically, we'll discount 2 or 3 years out on a revenue multiple back to net present value. And multiples have expanded dramatically. I think a year ago, I would have told you that, 2 times, 3 times, 5 times, upwards of high single digits was getting very, very expensive. Now there's scores and scores of companies that we look at that are 10 times, 20 times, 25 times. We also do look at EBITDA and EPS for companies that are producing earnings and EBITDA or adjusted EBITDA and cash, which is probably about a quarter of the companies that we currently cover. I'd say the EBITDA multiples that used to be in the 8 to 13 times are now in the mid and high teens for growthy focused medtech companies, and EPS for the larger companies has expanded a bit, generally speaking. So, from low 20s to high 20s or low 30s across the board in our space. So I think that does it as far as our official commentary, and we wanted to open it up for any specific questions or items, or I'm going to continue to speak for another 3 minutes if I don't get any questions that come in through the board that I'm looking at. So what I wanted to also touch upon is the number of companies out there. So more and more companies are in the public domain. We're seeing more and more private companies pondering or looking at vehicles and avenues to become public. Some other areas besides IPOs, as far as an avenue to go public, we're seeing reverse mergers as well pick up steam over the past year. And what we're also seeing is SPACs in the marketplace. I'm sure that everyone here has heard this word over the past number of months. So there's more and more SPACs, these special purpose vehicles, whereby a pool of assets are collected that are shopping for or looking at finding something for that company to control whether that is, it's typically a private company. It typically may or may not be revenue producing over the past year or two. The SPAC will get started with a certain amount of assets, and then depending on what they're purchasing as their acquisition, they may in fact do more capital raising, which could come from the company side, current holders, prospective holders, as well as public market holders. So the performance of SPACs has been very volatile. Generally speaking, it's been upwards and higher for some of these SPACs. I think there's been a lot of exuberance as far as some of these companies, but from our perspective, we look at it or look at them from a fundamental standpoint as far as our valuations go. So we do have a couple questions that I'm just reading off here. One relates to cardiology or spine as far as bounce back on trends. It's a little too early to have any clear data. I think in the case of cardiac, these procedures that were formerly deemed elective are not so elective anymore as persons, their ejection fractions and their states decrease. So they need certain procedures done, whether that be valve work or bypass work. They've been coming off a backlog onto procedures. Spine is mostly related to pain in most cases. So by holding off, patients stay somewhat immobilized, but they do need to get procedures done. So backlogs, we talked to a number of hospitals that had backlogs in one or both of these areas in the hundreds last spring and summer. Those backlogs have come down, but there's still arguably a few score for an average size, 500 patient hospital in the United States. I will mention again, if anyone wants to be on our distribution list, to shoot us an email to jcohen@ladenburg.com. Another question is related to healthcare IT and consolidation. We do expect more and more consolidation from healthcare IT. The reality has been over a number of years that smaller players in the space are not able to innovate and consolidate product offerings like the larger players. So a company such as MTBC has been able to garner that scale with a back office platform of approximately 3,000 employees and lever up, whereby they had about 10,000 healthcare providers on their system a year ago, and now they're over 40. So we anticipate those trends to continue on the consolidation front. Consolidation in other medtech areas continues to be strong. No significant or material change to read into either way. We do, continually hear about acquisitions and mergers. Seeing a couple other questions that I'll get to. Someone's asking for some commentary on SPACs versus IPOs. I think it's a little early to definitively come out with any lessons learned, but certainly if a SPAC is already set up, it's far faster and far less expensive for a private entity to get tucked into a SPAC and be trading publicly, because as we know, an IPO process could be 6 to 12 months, or a traditional IPO process could be 6 to 12 months. So SPACs are faster to the market. And I should also note that reverse mergers are faster to the market. So, again, we remind the smaller companies that just because the larger companies want to talk to you and know what you're doing, it doesn't necessarily mean they're going to purchase you tomorrow. So the larger companies, I like to say, the strategics in medtech, they're not necessarily in the babysitting business, as I put it. They're interested to know, and they're paid to know, everyone that's out there, what they're doing, what's being developed, what's on the horizon. I think the strategics would rather acquire or tuck in or partner with these smaller companies when they've reached some type of critical mass. Critical mass, from from our standpoint, it's been defined as, presence at 50 to 150 hospitals, or 100, 100-ish type units being out there and being utilized with data, presentations, and more patients that have been served or helped by these solutions, as well as reimbursement, as well as continual analysis from the economic standpoint. So I think that does it on time. Thank you very much for paying attention, and I wish everyone a nice conference and nice week.